Good evening, one and all. Myself, Dr. Rupa, consultant obstetrician and gynecologist, Shrestha Hospital, Hyderabad. Today, I am here to discuss little important topic, the first step of gynecology. That is, let's see some important points regarding the anatomical presentation of the female reproductive organs. Okay, right. Female reproductive system. See, up till PG, nobody knows the proper reproductive organs, where is the site, what is the blood supply, what is the anatomical structure, exact position. So, we'll see little bit detail regarding the female reproductive system. Okay, right. See, as we all know, the reproductive organs in females are concerned with, okay, copulation. Okay, and next is the fertilization. You all know fertilization, right? The meeting of the sperm and the ovum result in the formation of a fertilization or a fertilized egg. Okay, and this fertilized egg develops, that is the growth and development of the fetus. Okay, if you want, you can take the notes of it also. Okay, next. So the female reproductive system is divided into the first point, external genitalia. As you all know, what is external genitalia? External means the things which we can see with the naked eyes. Okay, see this image. See, this is the external genitalia. Okay, that we can see directly when a patient comes to the OPD. What happens? First, we'll see what is that. So, we'll see what we'll see. Mons pubis. Okay, this is the mons pubis, labia majora, labia minora, the clitoris. Okay, the urethra, the vagina, we will be seeing. Okay, we'll study regarding it in detail. Okay, next is the internal genitalia. Internal genitalia means the organs which are placed in the pelvical region. Okay, we cannot see it directly with the naked eyes. For seeing these organs directly, what we have to do, when we can see this, we'll see this at the, we'll see the uterus at the time of cesarean section, or ovaries, or fallopian tubes directly, or in laparoscopy, in diagnostic laparoscopy also, we can see how the organs are presented. Okay, these are the internal genitalia. And the next is the accessory reproductive organs. What are the accessory reproductive organs? Those are the breast organs. Okay, accessory reproductive organs means these are not included into the reproductive system, but this is secondary to the reproductive system, like breast. Okay, right. We are going to the next slide in detail. First, external genitalia. Okay, is also known as vulva. So many doesn't know that external genitalia is also known as vulva, and it is also known as pudendum. Pudendum, another meaning is pudenda, means external. Okay, pudenda itself is external. So what are all the things we can see with the naked eyes when a patient come to the hospital into your OPD, that is external. Okay, as I said, visible genital organs. Okay, visible external genital organs in the perineal region, perineum. Okay, so next what we'll see, first thing, vulva consists of, see, so many doesn't know what is the difference between the external and internal organs. Okay, now we'll specifically in this video we are going to discuss regarding external organs only. Okay, first is the mons pubis. See this, this is the mons pubis. Okay, this is the mons pubis. This organ, this is the mons pubis or mons veneris. Next is the labia majora. See, this is the labia majora, the greater lips. Okay, the next is the labia minora. See, this is the labia minora. These are also known as lesser lips. Okay, and next is the hymen. We'll come to know regarding this in the coming slides. Okay, this is the hymen, piece of tissue which will be covering the vaginal orifice is the hymen. We will be reading regarding it. Okay, and next is the clitoris. See, this is the clitoris. Okay, we will be again seeing how it differs from the male genitalia and how the female genitalia are there. We will see regarding it also. Okay, this is the clitoris. And next is the vestibule. Vestibule means a small chamber like thing. So if we take this as a chamber completely, okay, so small chamber like thing, a box like thing. And what are the structures present in the vestibule are, first point, the urethral opening. See, urethral opening. Next is the, as I said, vaginal orifice. Vaginal orifice or It is a small structure which is inside. Okay, it is also known as introitus. See, this is the introitus. Okay, so urethral openings, vaginal orifice or the vaginal introitus, and the third is the Bartholin glands. Okay, we'll come regarding it. Okay, in this slide there are not there. See, small glands which are present. Okay, Bartholin glands, and next are the paraurethral. See, paraurethral means urethral glands. Okay, just beside the urethra are the next side thing. So this is known as paraurethral. Okay, right. So this will be just posterior to that of the urethra. We will see that also. Okay, and these glands are also known as skinny ducts, skinny tubules or skinny ducts. Okay, what all are there? Just we'll revise a little. Okay, first is the mons pubis, next is the labia majora, and third is the labia minora, and next is the hymen, then clitoris, and the vestibule, a box-like chamber which consists of four other small reproductive parts. Okay, those are the urethral openings, vaginal orifice, Bartholin glands, and also the paraurethral glands. Okay, come on, we'll go to next slide. In each slide, we will know about each organ, its functions, and this importance. Okay, next, mons pubis or mons veneris. This is the thing. Mons pubis or mons veneris. See, it is. Why it is called as mons pubis or mons veneris? Because it is a fatty tissue or the adipose tissue which is lying over the pubic bone. Okay, it is lying over the pubic bone. Therefore, it is known as mons pubis or mons veneris. And it is similarly, just simply, it is an inverted triangular in structure. Just it is inverted triangular in shape with fatty tissue or the adipose tissue over the pubic bone. Therefore, it is known as mons pubis. Next, it is covered from pubic hair from the time of puberty. Okay, when the time every girl attains menarche or maturity, what happens is small hair develops, hair follicles develop over this pubic region. So it is known as pubic hair. Next, what is the function of this pubic part? What is this? Why? What is this pubis? Mons pubis importance is it gives a cushioning effect or a soft like feeling. It gives a just cushion like effect. Okay, cushion like effect, and it also protects the bones underlying it. So the fatty tissue or the adipose tissue which is present in the pubic region protects the bones or tissues present behind it. Okay, so this is the importance of mons pubis. Just will revise. Okay, so it is inverted triangular. You can see it inverted triangle in shape. It consists of fatty tissue, first point. Okay, next or some adipose tissue, and it is covered with the pubic hair, and it gives a cushion like effect. Cushion like effect means a soft structure like thing. Okay, what soft like structure means? It helps in protection of other parts behind it. Okay, right. Next, next important thing is labia majora. In all the things important here, it is about labia majora. See, labia majora. As I said, as I shown in the previous slide, see, these are the two fold-like structures. See here, these are the two folds. You can see here, no? This is the labia majora. And next, as I said, these are the just a folds of fat, same fatty tissue as well as same alveolar tissue. Okay, see the outer surface of the labia majora is covered with skin and pubic hair. It consists of skin and pubic hair. But see the inner surface, it is very soft, moist, pink in color. Okay, so in labia majora has two parts. It has a outer surface that is the skin and the pubic hair, and the inner surface which is hairless. This is very important. Sometimes you'll get as a MCQ. Okay, name the structures which is hairless. Inner surface of the labia majora. It is very soft, moist, pink in color. Okay, next see. And what is the importance, as I said, how to differentiate, okay, between the male and female reproductive organs, and how the female reproductive organs are similar to the male reproductive organs. This is also very important. Okay, see, in females, okay, and in males, see, this labia majora is homologous, meaning is similar. Okay, it is similar to the scrotum in the males. How the females have lemia majora, Same, I'll show in the coming slides. I'll show the diagram of it also. Okay, see, this labia majora is similar to that of the scrotum in the male. Just I have kept this image so that you can easily identify and easily remember. See, in anatomy or anything which has a mechanism, you should never by heart. Best thing to understand the anatomy is you should see number of images. Okay, by seeing the images only, we can remember the anatomy very well. Okay, so why I kept the image of scrotum here? Why I kept the image? Because when you remember the labia majora, the homologous organ in the male should be remembered as scrotum. Okay, next. As I said, uh, development of the genital organs is also important. From where it has it developed? Okay, anatomy is a little bit difficult thing. Okay, so you have to remember it. So see this image clearly. See this image clearly. Labia majora develops from labioscrotal folds. See this scrotal swelling here. See the blue image like thing, the scrotal swelling. Similarly, in the female, these swellings are developed as labia majora. Okay, similar thing. See, this thing. Okay, in males it is the scrotum, and in case of females it is the labia. And so, generally we call it that labia majora develops from the labioscrotal folds. And the next thing is, see, from where does the labia majora arises? See, in this image, where is the starting point of labia? This is the starting point of the labia. Now you can say it. From where does the labia majora start? It develops from the mons pubis. And where does it end? Where does it end? It end into the perineum. Okay. See, this side it is one labia majora. As I have said, there are two folds, right? So this is one side of the labia majora, and the other side of the labia majora is this. So what happens is these two labia majora are meeting at one point or at one junction. Okay, any meeting point or any junction we generally call this as commissure. Not only here, anywhere, any meeting point or any junction, we call it as commissure. Okay, and this commissure is on the posterior side. So it is known as posterior commissure. Now you please see this line. It arises from the mons pubis, right? See here. It is from the mons pubis, first point. And the both the labia merge into the perineum. Okay? Perineum. To form the commissure, it is posterior, so it is known as posterior commissure. Okay? Next. And see, this labia majora, see, it consists of every tissue, every organ consists of epithelium, right? And mostly it is of squamous epithelium. Okay, squamous epithelium, it consists of, as I said, labia majora is soft, moist, pink. Moisture means some glands should be there. So it is the sebaceous glands or the sweat glands are there. Okay, and hair follicles. As I said, the outer surface of the skin of the labia majora consists of hair, and okay, so it also consists of sebaceous glands, sweat glands, and also the hair follicles. Okay, and it is also an important MCQ in your bit. The modified sweat glands of labia majora are known as apocrine glands. I'll show you an image also regarding it. Okay, apocrine glands. This is one of the MCQ. Okay, so modified sweat glands are the apocrine glands. And next is the C. What happens is this labia majora consists of some sweat glands, as I said, that's apocrine glands. Okay, apocrine glands, and it produces some characteristic aroma. Aroma means is some sort of smell. Okay, characteristic smell, and this forms a rare tumor. Okay, very rare tumor. Okay, we doesn't hear it so commonly. Means we hear endometrial carcinoma, right? And cervical carcinoma or any ovarian disorders, ovarian tumors, but we don't hear any important carcinoma regarding the labia majora, right? So it is known as a rare tumor. It is known as hydradenoма of the vulva. See here, I have kept the image here. See, this is the image. See here, see, this side labia majora is quite normal. There is nothing. But see here, okay, some swelling, some sort of swelling is present here. Okay, this is a rare tumor of the labia majora, that is hydradenoma of vulva. Okay, so next is and see the adipose tissue. The labia majora consists of the tissue, right? It is has rich venous supply. Okay, rarely blood supply will be there. So what happens is the adipose tissue is supplied with rich blood supply, and at the time of childbirth generally episiotomy will be given here, right? We generally cut here, right? Okay, episiotomy will be there. So if this is injured, what happens is, if we doesn't suture it properly, what happens is it leads to the formation of hematoma. Hematoma means, hema means blood, toma means a small tumor like this, small tumor. Okay, what happens is it forms a small clot like thing appears. This is known as hematoma. Okay, so important points to remember in labia majora is, first point, it is homologous to. So you can remember the image of scrotum placed here. So it is homologous to the scrotum in males. And the second important point is it develops from genital swellings, that is labioscrotal folds. Okay, and the third point is a rare tumor arises from labia majora, that is hydradenoma of vulva. It produces a characteristic, a peculiar aroma. Okay, and mostly in external genitalia, where does the hematomas form? That is a labia majora. Okay, is it all clear for you? Right. Now come regarding the labia minora. Okay, nice. See, as we have seen, see here, this is the labia majora, this part. Okay, and inside the labia majora is a smaller lips, that is the labia minora. These are the labia minora. Okay, these are all the thin for, see, labia majora is thick because of the fatty tissue, adipose tissue, that is a two folds of fat. But in case of labia minora, what is this? Is thin folds. Okay, thin folds. Next, labia minora develops from, see, these are two thin folds, right? Genital folds, and this is homologous to ventral aspect of penis. Similarly, how the reproductive organs of the male will be there, if we compare the labia majora, it is similar to that of the ventral aspect of penis. For that only I have kept this image, just to understand, that's all. Okay, ventral aspect of penis. Next is, see what happens is, first thing, anywhere in anatomy, first thing, where it is present, where does it start, where does it end, what is the blood supply, what is the venous drainage. Okay, any peculiar important one or two points regarding the that organ is important, not only in gynec, anywhere. Okay, so what is it, where does it start, where does it is present, okay, where does it end, what is the blood supply, any two important points regarding that organ. Now see, anteriorly what happens is, see, where does it start, see here, these are the labia minora, right? See here, why I have kept these images is, if you see the images, remember the images, what happens is you can answer the question. Okay, see, anteriorly they divide here to enclose the, see, this is the clitoris, right? This is the clitoris. Okay, anteriorly they divide to enclose the clitoris, and posteriorly they fuse in the midline, they just fuse across the midfold, okay, midline, and it forms a thin fold of skin. See, a thin fold of skin known as fourchette. Thin fold of skin it will be forming, and the particular name of the thin fold in case of labia minora is the fourchette. Okay, so anteriorly they divide and enclose the clitoris. Posteriorly, uh, they fuse here to form a thin fold of skin called as fourchette. Okay, next. And as I said, fourchette is a thin fold of skin. Okay, it is identified when the labia is separated. You can see here. And this fourchette is often tore. That is, often it is tearing. Okay, in the posterior part here. Okay, it will be tearing in the posterior part. And next, see here, between the, see, this is the vaginal orifice. Okay, this is the vaginal orifice and this is the fourchette. Here, a small cavity-like thing is present. A board-shaped cavity-like thing is present. It is known as fossa navigularis. Like a board-shaped, small board-shaped depression is present. It is known as fossa navigularis. Okay. So, what are the important points in this labia minora to remember is uh, from where does it develop and what does it resemble, to what things it is homologous to. Okay, this is the important point here. And we have read regarding the fourchette. There's a thin fold of skin in the middle, and between the fourchette and the fossa, between the fourchette and the labia minora is the fossa navigularis, a boat-shaped depression. You'll come later on. Some people say that the ducts of the Bartholin glands open into this boat-shaped wedge-like structure. Okay. Right. Next, as I said, we'll see how it is differentiated, right? First, we learned regarding the labia majora. See here, just to remember only, okay? In male, the urogenital sinuses divide. If it is a male, it forms the scrotal swelling, okay? And in female, it develops into the labia majora, labial swelling, okay? Second thing, see here, in case of labia minora, see, it resembles the ventral aspect of penis, labia minora. Okay. And next, see here. Ventral aspect of penis. It develops from genital folds. Okay. Labia minora. Okay. We'll see regarding the clitoris and all. You will understand it. See, in case of clitoris, see here. Genital tubercle. See here this. Okay. And see the clitoris here. Genital tubercle. Okay. See. So, in case of genital swellings, that is labia majora. In case of genital folds is labia minora. And in case of genital tubercle is clitoris. Okay? Right. These are enough. If you remember, see, if you remember 10 points also, remember the 10 points. Don't read 20, 30 points and get confused. Okay? See, if you remember these three, the odd one is the fourth. So you can identify in that pattern also. Next, clitoris. Okay. So, see, as I said, let us show the individually here. This is the clitoris. Okay. So, this is the clitoris. Okay. Almost it is about only 1 to 1.5 centimeters, very small. Okay. Rarely what happens is this clitoris will be little long. Okay. It might be about 3.4 to 4 centimeters. Okay. 1 centimeter in one big. So, okay, we call it, if it is enlarged, what we'll say clitoromegaly. Okay. So, normal size is only 1 to 1.5. If it is little enlarged, it is about 3.5 to 4 centimeters. It is called as clitoromegaly. When will we see these conditions? See, in case of some hormonal disturbances, okay, hormonal disturbances, virilism, we call it as hormonal disturbances, like any male pattern hormones are present in the female. Okay, that time what happens is this clitoris resemble like a penis in a female. That we can see at the time of birth of the newborn, or later on when a mother brings that some difference is seen in our girl. So let's identify it like that. We can see the clitoromegaly conditions. When the male hormones are present in female, then we can see the clitoromegaly, especially male hormones like androgen, testosterone. Okay, at that time we can see the clitoromegaly. And as I said in the previous slide only, see this clitoris genital tubercle develops into clitoris. Genital tubercle, okay, that develops into clitoris. And next is, where is the clitoris present? Now you all only will saying, see, it is present in the anterior most part of the vulva, right? It is present in the anterior most part, right? So anterior most part. Where is it present? Anterior most part. Some people will be, just to misguide you in the questions, they will be saying that posterior part of the clitoris, like that they will be mentioning. Where is it? Anterior most part. Okay. And next is, see, it is similar to that of, just now I have said, it is similar, it is homologous to that of the penis in the males. It is homologous to the penis in the males. See, this is the clitoris of the female and the, see, the penis in the male. Both are similar, right? Okay, next thing is, see, it is extremely sensitive, okay, and highly vascular organ. Okay, we'll come to read regarding it. Okay, so what are the important points here is, generally the normal size of clitoris is important. It is only 1 to 1.5 centimeters. And regarding clitoromegaly also they can ask. And next, where does the clitoris develop from? That is of the genital tubercle. And where it is situated? In the anterior most part of the vulva. It is similar to penis of the males. Okay, we'll go to next slide. Okay, it is nothing, just this clitoris is attached to the pubis. How? Just a suspensory ligament. So it is attached to this clitoris. This clitoris is attached to the under surface of the pubis with the help of a suspensory ligament. Okay. Right. Next, as I have said, vestibule means a small chamber-like thing. Okay. See, in this image you can clearly see a triangular space-like structure, right? Okay. See, it is a triangular space-like structure. Okay, we'll see. As I said anteriorly, this is the clitoris, right? Clitoris, posteriorly by the thin fold of skin, right? Porchety. And on either side by the labia minora. Okay, labia minora. So if you remember this image, see here. It is bounded anteriorly by the clitoris, posteriorly by the porchety, and on either side by the labia minora. As I have said, vestibule is a box or a chamber-like structure. We'll see what are the structures this box will contain. Okay. See the openings into the vestibular. Now you can only see this. First point, urethral opening. Second is the vaginal opening, that is the vaginal introitus or vaginal orifice. And see here, it is covered with a tissue, just thin tissue-like structure known as hymen. Okay. And here will be the Bartholin glands. Okay, Bartholin glands. And here will be the Skedes glands. We'll see regarding it, I'll show you. As I said, see, urethral opening and paraurethral. Okay, urethral opening and Skenes tubules, vaginal orifice or the vaginal opening or the vaginal introitus. And next is the Bartholin glands. Okay, and next is the paraurethral glands, or these are also known as Skenes ducts. Okay, right. Okay, we'll remember only 2-3 points regarding all this so that you don't confuse. Okay, next, urethral opening. Where is it? See here. This is the urethral orifice of the urethral opening. See, just it is situated in the midline, right? It is situated in the midline. See here, in the midline. Just, okay, in front of the vagina. This is a vagina, right? Now you can only say it is situated in the midline, just in front of the vaginal orifice and just posterior to clitoris. Okay, they will be asking what is the location of the urethral openings. Okay, it is in the midline, just in front of the vaginal orifice and just posterior to the clitoris. Okay, and the next thing, what happens is the see here, Skenes glands, Skenes tubules. Okay, and see the urethra. Okay, see, these are the Skenes tubules. These open on the posterior surface of the urethra. Okay, where is the location? Where is the location of the clitoris? Anterior, right? And where is the location of the Skenes duct? Posterior to that of the urethra. Mostly anatomy will be very easy, but you should remember it in the image form. You should understand its relations with the other structures near it, so that it will be very easy to keep in your mind. Okay, next. Now is the vaginal orifice or vaginal introitus. See. This is the vaginal orifice. Okay, we'll see regarding it. See, it is present in the posterior two-thirds of the vestibule. Just now we have discussed that vestibule is a box, it's a chamber, it consists of some of the important structures present in it. See, if this is completely a vestibule, see, if this is the anterior one-third, right? And this is the posterior two-thirds. First point is it is present in the posterior two-thirds of the vestibule. See, it depends. It is of varying size and shape. Okay, you'll come to know regarding it. Posterior two-thirds of the vestibule. It is of varying size and it is of varying shape. Okay, next we'll see. And as I said, why it is of varying size and varying shape. Okay, we'll see. See, in case of virgins, or in case of nullipara, what happens is this vagina is closed by, see, this is a vagina, right? And this is the labia minora, right? So this vagina will be closed by the labia minora. They will be asking. In virgins, the vaginal orifices are closed by labia majora, clitoris, minora, or some forchati. They will be asking you. It is closed by labia minora. Okay. Why I'm saying only the basic things means first basics are important. If you remember the basics well, then you can go high up to any level. Okay. So labia minora. Next, in case of, see, I have said regarding the virgins and the nullipara here. In case of a parous woman, okay, it is exposed and it is of different shape and size. For that only, see, it is of varying size and shape. Okay, we'll see. And next, see, from wherever we are coming regarding the word hymen, I am saying that it is covered with a thin piece of tissue, thin piece of tissue. This tissue is known as hymen here. See, vaginal opening is completely closed by a mucous membrane. Okay, or a thin piece of mucous membrane. It is known as hymen. Okay, what are the things we have to remember in this slide is, see, where is the vaginal orifice present? Posterior two-thirds of the vestibule. Okay, it is of varying size and shape. Just now we have discussed. Okay, and it is covered by labia minora. This is also important. How it is in nullipara or virgins, or how it is in parous women also, you have to remember. And one word regarding the hymen. Okay, one word regarding it. Okay, next. Okay. What is important is, see, as I said, in virgins or nulliparous women, it is covered with labia minora, and there is hymen also. So in the virgins, how the hymen is? See how the hymen is. It is circular. Okay, we'll see how the hymen, it is circular in shape. Sometimes it is like elliptical, concentric in shape also. Okay, circular in shape. But when the hymen is ruptured is, that is consummation of marriage. Okay, when it is ruptured, consummation of marriage, and mostly hymen is turned. Where does it tear? See here, posteriorly. Okay, or posterolaterally. Will come regarding this image. Okay, so important bit is posteriorly or posterolaterally. Okay, now next, see, sometimes what happens is during the childbirth this hymen gets stored, that it is replaced by small tags, a new fresh tissue it will be replacing. Okay, so what happens is this newly replaced hymen is known as caruncle mitriformis. When it is replaced after childbirth, we call it as caruncle mitriformis. Okay, and okay, we'll see regarding the different shapes of the hymen. Okay, see here, imperforate. It is completely closed. Imperforate means closed, right? Imperforate. Annular, only one opening in the hymen. Septate hymen. See the hymen, it is divided into septate. See here, septa is there. And cribriform. Cribriform means multiple openings. Multiple opening means we see in our house that we have a sieve. Okay, which with we refine our flour and all, rice flour or anything, any other thing, suji like that. So multiple openings will be there. See here, this is known as cribriform with multiple openings. Cribriform, okay, and only one opening is the hymen. Okay, annular hymen. One opening is annular hymen. Multiple openings is a cribriform hymen. And see, In case of Paris woman, it is of different shape, different size. Okay, different shape and size. In this, what we have to remember, what are the important points you have to keep your brain. Okay, that is, see, in case of virgins, hymen is circular. It is mostly ruptured at the time of consummation of marriage, torn posterolaterally or posteriorly, and at the time of birth, it is replaced by new tags. That is, it is also known as caruncle mitriformis. And if it has one opening, it is annular hymen. If it has multiple openings, it is cribriform hymen. In Paris woman, it is of different shape and different size. Okay, next. Now the Bartholin glands, one of the important topic. Okay, we'll see regarding it. See, these Bartholin glands are also known as vestibular glands. We call it as greater vestibular glands. Now, there are two Bartholin glands, like two labia majora, two labia minora, two Bartholin glands. Okay, see here. Two, one on each side. See here, Bartholin glands. Okay, one on each side. Okay, and next. Okay, as I said, labia majora, it is homologous to something in the males. Labia minora. Okay, clitoris. Like that, this Bartholin glands are also homologous to the Copper's glands. See here. Just I have kept this image so that you will remember it. See, similar like Bartholin glands only, how the small glands are placed. These are similar to Copper's glands, all the bulbourethral glands in the males. Copper's glands or bulbourethral glands. This is an important question. Okay, your MCQ. And next, they lie posterior here. Where is it? This is the labia major, right? Okay, this is the labia majora. So, on the posterior part of labia majora, okay, they open, this is the vagina. See this image clearly, how nice it is. See, they open posterior to labia majora, and this duct open into the vaginal orifice. See, this is a Bartholin glands and this is a duct of the Bartholin glands. Okay, see, it is posterior to labia majora, duct open into the vaginal orifice. And Bartholin glands, as you only can say, it is oval shape, just small in size, peanut size, yellowish white in color. Okay, why it is yellowish white in color, we'll see. Next is, see, generally we never palpate Bartholin glands. In a normal patient, we never palpate it. Okay, but see, if there is some infection, see here in normal anatomy how the Bartholin gland is very small, right? But see here, in case of any infection, how the gland is infected. See, this develops a cyst with some pus, with some fluid-like structure. Later on, you will be learning in the further classes, okay, regarding the Bartholin cyst. This is only the general anatomy I am saying. We'll come in detail regarding the vulva and what are the things in it, okay, and in coming classes. So, they are not palpable unless they are enlarged. Means, if there is any infection, they have to enlarge. At that time, we'll come to know regarding it, okay. So important points is location of the Bartholin glands, and it is similar to Copper's glands or bulbourethral glands. These two are important, right? Next, we'll see regarding the Bartholin duct. In this image only you can see everything. See here, it is almost 1.5 to 2 centimeter. Okay, see here. This is a duct and this is the gland. Okay, we'll see. Come. It is about 2 centimeters long, right? 2 centimeters long, and see the duct open into the vaginal orifice, right? See the duct open into the hymen at the junction of anterior 2/3 and posterior 1/3 in between the hymen and the labia majora. This is very important, very important. This is an important previous question. See, where does the Bartholin ducts open? Okay, see, it is at the hymen. See, the hymen, this is a hymen. Okay, at the anterior 2/3 and posterior 1/3, the duct will be opening. Anterior 2/3 and posterior 1/3. And see, in between the hymen, in between the, see, this is the labia majora. So, it is located posterior to the labia majora, and the duct open in between the hymen and the, see, this is the hymen and the minora. So, the duct opens into the minora and hymen. Okay, at what positions? That is at 5 o'clock and 7 o'clock positions. Some say it as 4 o'clock and 8 o'clock positions also. If this is a watch, where will be the 5? here. Where will be the 7? Here. Same in this position only. With this you can understand it. See. So it is situated posterior to labia majora and the duct open into in the groove between the hymen and the labia minora at 5 o'clock and 7 o'clock position. And at the hymen it is situated at anterior 2/3 and posterior 1/3. Okay. And next, as I said, most of the reproductive organs are lined by squamous epithelium. See what happens is here. See, initially the duct is lined by squamous epithelium. Initially, but later on, when the ducts are reached to the gland, it is lined by transitional epithelium. Initially squamous epithelium, later on by the transitional epithelium. When the see the duct is lined by squamous epithelium, okay, which changes to transitional epithelium as the terminal ducts are reaching the gland. See here. Okay, so this is also important. And see, if there is one organ in the body, some function should be present. Okay, some function should be present. Nature has designed like that. Okay, so Bartholin glands are there. What is this function? What happens is Bartholin glands secrete the abundant alkaline mucus during the sexual excitement. Okay, they help in secreting some mucus like substance so that it helps in lubrication, it helps in softening. Okay, so Bartholin gland secretes some alkaline mucus with help in lubrication. Okay, so it is about 2 centimeters long, right? It is about 2 centimeters long and it opens into the groove of hymen and labia minora at 5 o'clock and 7 o'clock positions. Initially lined by squamous epithelium, but later on when the terminal ducts are reached, it is lined by transitional epithelium. And last is alkaline mucus, right? Okay, you are clear with it? Skinny stipules, last part, the fourth structure in it, in the vestibule is the skinny stipules. Okay, as I have seen, see, this is the urethral opening. Okay, urethral opening, and posterior to the urethra is the skinny stipules or skinny glands. Here it is here, it is here, posterior to it. Location is important. And then where do you see? Where we see it, see, anterior wall of vagina, right? This is the vagina, just anterior to it and just posterior to the urethra. Okay, where are the skinny tubules located? Just anterior to the vaginal wall, posterior to the urethra. Okay, and next, see the skinny tubules, how small, how they are situated beside the urethra, like that only. See, this is the bladder. In the male also, see, this is the prostate. So the skinny tubules are homologous to the prostate in males. Okay, it is homologous to prostate in males. Just to remember. So similar to that of the other organs, the skinny tubules are similar to prostate glands of the male. Okay, only 2 points. Where it is located, for which thing it is homologous. That is important. Okay. Next, we came to the end. Okay, just 5 more minutes. Okay, see, blood supply. As I said, anatomy means where is the organ present, from where does it start, where does it end, what is the function, what is its blood supply are important basic things, and any other 2 important points regarding that organ. See, blood supply. We are from starting we are seeing pudenda, external genitalia, vulva. The word itself says that the blood supply is here. The blood supply to the external genitalia is from the pudendal arteries, both external and internal pudendal arteries. Okay, pudenda only is external, right? So, as the name itself indicate, it is external and internal pudendal arteries. So, the next is where is the venous drainage? So, see, this corresponding veins only drain the blood. So, external and internal pudendal veins only drain the blood from this vulva. Okay, so this is an important MCQ. What is the blood supply of the vulva is pudendal arteries, internal and external pudendal arteries. And the venous drainage is also similar thing. Next, let's see regarding the lymphatic drainage. See, whole of the lymphatic drainage of the vulva is to the inguinal lymph nodes. See, so this is the external genitalia, right? So see here, inguinal lymph nodes. So from there it is draining. This is the superficial and this is the deep. We'll see now. See, first the vulva will be draining into superficial inguinal node. Okay, superficial inguinal node. First draining lymph node we call it as sentinel node. You will learn regarding numerous sentinel lymph nodes in the coming topics. Okay, so first draining node we call it as a sentinel node. And see, this is see, from here it is draining to the superficial inguinal nodes. Later on from there it is going to the deep inguinal nodes. From there to the deep inguinal nodes. Okay, and then one important thing is there. Generally, first vulva, okay, it drains into inguinal lymph nodes. We'll accept it. But see here, some important thing is there. Clitoris drains directly to the deep inguinal nodes. See here, this clitoris is there, right? This clitoris thing directly drains into deep inguinal nodes, and we call this specific nodes as lymph node of Cloquet and also Rosenmuller lymph node. Okay, so everything drains into inguinal, superficial inguinal nodes first, but this clitoris drains directly to deep inguinal lymph nodes. This is known as lymph node of Cloquet and also Rosenmuller lymph node. So 2 points important. That is, it drains into inguinal lymph nodes, but clitoris drains into lymph node of Cloquet of Rosenmuller lymph nodes. And next, nerve supply. Last, that is just to remember, pudenda, external thing. It is also the nervous supply. The branches is pudendal nerve supply. That is with S2 to S4. Just to remember it, okay. Will come regarding it in detail in the coming vulval organs, those structures, any infections or any what is the importance, what are the cancers, everything will come in detail. Okay, so what is the nervous supply is arterial supply is pudendal arteries, internal and external pudendal arteries, and lymph nodes is to the inguinal lymph nodes, and for the clitoris it is special, that is lymph node of Cloquet or Rosenmuller lymph nodes, and the nerve supply is to the, that is similar, pudendal nerves S2 to S4. Okay, I think this video is little helpful to you. At least you'll gain some knowledge regarding the female reproductive system and it may be helpful to you. Okay, okay, let's meet in the next videos. Thank you.